All right, hi again, everybody. Well, I thought as the COVID cases continue in Cobb County, it'd be a good time to check in again with Dr. Janet Memark. She is the head of Cobb and Douglas Public Health here in Cobb County. And honestly, she doesn't have a lot of good news to tell us about. Cases of COVID-19 are on the rise nationwide in the state of Georgia and here in Cobb County as well. But as I sat down to talk with her, that news was breaking about the school district going to all virtual education when they start their online classes now in mid-August. And we also decided not to open some of our senior centers. And Dr. Memark was happy to hear both.
I have a lot of contact with the school systems, and I try to keep them as updated as I can of what's coming through our department. And right now, I have to agree with what they're doing because we have very high cases showing some high transmission levels. Our positivity rates continue to be increased throughout the county, and the testing is delayed. I know you've all seen and felt that, but we have a delay in trying to get a test, and results are being delayed. This is a nationwide issue. There's just not enough capacity to be able to take this surge in so many places at the same time. And so I have to agree, we can't isolate and quarantine people quickly, and we can't get results quickly, then that means that we really need to just cool down a little bit and not add people into the mix.
All right, so as I mentioned, cases are surging, not only here in Cobb County, but really in the entire state of Georgia. Here's her rundown of what that looks like.
So right now we have over 7,500 cases in Cobb County, and unfortunately that is coming with 250 deaths. But I did want to talk a little bit more about what's our status right now in Cobb. So with those, I know a lot of you have seen that we have a surge in cases, and we definitely, over the last few weeks, we were hoping it'd just be a little bit of a blip, but that doesn't seem to be what's happening. We continue to have a sustained surge of cases, so very high cases, and that's coming with some of the highest numbers of emergency room visits that we've seen as well due to COVID-19 related conditions, and some very high hospitalization numbers as well. Ventilators don't seem to be all taken up, but there is a strain right now on acute care beds as well as ICU beds for our area hospitals.
A lot of people have pointed on social media to the fact that the deaths are down, or at least have been trending down, even as other cases go up. Dr. Memark, though, says a lot of those cases that are showing up now are in the younger generation, and when you look at the numbers, she does not see a trend she likes.
When you look at cases at one point in time, that's a very difficult number to look at. We really need to be looking at what are the downstream effects. So, how are the hospitalizations doing? If the hospital is being overwhelmed, then we really got a big problem on our hands because they can't take care of anything that we need. So they're hanging on right now, but we also look at the deaths and how that is happening and the number of outbreaks that we're seeing, and everything seems to be a little elevated right now.
And another big development that's happened recently is the fact about testing, getting tested, and how long it takes to get results. And I'll pause right here to say, at the end of this video, if you're squeamish, you may want to stop it earlier, I'll warn you, but I want to show you exactly what testing looks like. So if you haven't seen that yet, that'll be at the end. If you're squeamish and you don't want to see that, I'll give you plenty of warning when you can turn it off. But the bottom line is, it used to be a couple of days for test results, not so much anymore.
No, we were doing great. There's some that were getting them like within a day, which was great. And now the number of tests that are being performed is just unbelievable. And so we have a very high number of cases. So it's looking 4 to 6 days right now for test results to return. And I know people are trying to get tests, and it's difficult to get them, but we are right now looking at ramping up the testing capacity, and we have outreach efforts that are going out as well.
All right, so about testing, we started this COVID crisis with the ability to test very few people. Then we got to a point we were offering testing to everybody and anybody who wanted to get tested. Now Dr. Memark would like to see only those get tested who really need to get tested.
We are having a lot of people that are getting tests that maybe don't need them right at that time. We're asking people to just really review the guidelines of when they should get tested. So we need the medically fragile who are in high risk situations for them to get tested, the elderly and people with chronic conditions, and people like our public safety and healthcare workers still need to have availability to get tested. Now, there are a lot of people that want to get tested for many reasons, but one of the big ones that we're hearing is you're a contact of a contact or you're a contact to somebody that's COVID-19. So if I find out that I'm a contact of somebody that is positive for COVID, I find out yesterday, and the last time I saw them was, or when I had contact with them was yesterday. Today is too early to get a test. You really should be waiting till at least the 10th day to be able to get a test after being exposed to somebody. And that's because the body needs time for incubation to show up positive on a test. But I've said this before, if you come back negative on that test, you are not released from quarantine. You must complete a 14-day quarantine. If you become symptomatic or have a positive test that happens in that meantime, now you go down the isolation route, and then you have a different set of guidelines of how much you have to stay at home.
And the fact that the news is getting out that it's taking so long to get results, and then quarantining is 2 weeks of your life, that a lot of people have decided not to get tested and actually kind of put their head in the sand and forget about COVID-19 altogether. She sees a lot of people living life as normal, and that's not something she wants to see.
That's a great comment and observation. So you remember when we started this whole thing that we were unable to get tests in a timely manner or results. Case investigations were also delayed because of the surge in cases that we had. Well, this is a similar picture to that. So it doesn't make sense that we become more lax in what we're doing. So we really shouldn't be meeting in large groups or not social distancing or wearing masks or things like that, because transmission is high and it's hard to control it right now. So if we continue to go that way, it's just going to make the situation worse.
She also wants to talk about what happens should you get a positive test.
The CDC guidelines for a person who is positive and under isolation to be removed from isolation so you can go back into society, there are two different methods that are listed. There's the test-based strategy and the time-based strategy. Right now, the test-based strategy cannot be used effectively because we cannot get the tests and we can't get them in time. So it's the getting 2 negative tests to be released and to go back to your everyday life. Your test could be positive for more than 6 weeks. You can be out of commission for 2 months, and we're not going to be able to get you the test in a timely manner just to do a confirmation for you. We have to take care of the people that are really symptomatic and get them the test. And so the time-based strategy is what's recommended. If you have symptoms, you have to wait at least 10 days first, and you have to have no fever for at least 3 days and an improvement of symptoms for at least 3 days. So 10 days plus at least, the 3 days after your symptoms have resolved. That's the time-based strategy. If you have no symptoms and you came back positive, you have to wait at least 10 days from that positive test. And make sure you don't have symptoms, because that goes the other route. And so that's the strategy that's being recommended, not the test-based at this time.
And here we go again, back to the mask debate. Some people believe in them, a lot of people don't believe in them, and Dr. Memark's really tired of fighting that battle. She wants to continue to live by the mantra of washing your hands, watching your social distancing space, and wearing your mask. But she says, really, that's about all we have.
All I can do is, let you know what the recommendations are. Now CDC has officially come out that we should all wear masks when we're out and about and unable to socially distance, and so in public. So masks are the best thing that we have right now. So we have to wear the mask in public when you cannot socially distance for sure. But wear your mask in public. We've got to continue washing our hands, staying 6 feet apart, and please stay home when you are sick. I'm seeing too many cases of people that are positive that knew they had symptoms and they were going to work and to different places. So please don't do that.
And again, about those death rates, Dr. Memark says a lot of people point to the fact that fewer people seem to be dying, or at least not in the numbers that they initially did when the COVID pandemic was starting. But she says that could really be a lagging indicator.
First of all, this is a new surge in cases. So the jury's out on what's going to happen with the deaths, and we hope that they continue to stay lower, right? But you know, if you have a high enough number of cases, you will see more deaths that will occur. What we're seeing is younger folks still that are being admitted and they're coming back positive with COVID-19. What I'm hearing though from the hospitals that's concerning to me is that there are some inflammatory effects that we're seeing from COVID-19 in these folks. They are seeing young folks that are having strokes and heart attacks, and that was not expected to happen. So even though you don't die, you can be debilitated with heart damage and have stroke residual deficits. I don't think that's what we want for people. And so just because you don't die doesn't mean that you're not going to be seriously afflicted from this.
All right, thanks to Dr. Memark. And here's the point of the video. Like I said, if you're squeamish about medical stuff, things happening to people, you might want to end it here, go away, call it a day, and come back for our next video. But if you want to see what testing looks like, I had to go through it. I'm having a minor procedure done. They make you get a COVID test before that is going to happen. So this was down at Wellstar Kennestone and their new ER. They had a little testing site set up there, and this is what it looked like. You've probably heard about it. Maybe you've seen it, maybe you haven't, but it's a rather long Q-tip. I'll just put it that way. And it was just as pleasurable as it was advertised to be. But listen, if I could survive it, anybody can. I just thought you should take a look and see what that testing looks like if you haven't yet. I survived, still waiting on my test results. I got a little bit before my procedure, so we'll see what happens and kind of knock on wood that everything turns out okay. And I hope it does for you as well.